good morning. I'm Reverend Sheffield, CEO of the Detroit Association of Black Organizations, federation of 139 black and non-black organizations fighting together to be able to pool our resources and create a common agenda to address health care and other inequities that exist in our community. Come on, let's go inside and talk to some more people and talk about what they're doing so you know more about who we are. Just want to welcome you, showed you a little bit out in the parking lot. Now we're going to give you a tour and have you talk to some of the folks who are here. They've not been here as long as me. Let me just tell you some of our history with health. We addressed teen pregnancy 30 years ago, had one of the most robust programs. We had funding from the Michigan Department of Public Health, had private funding, and what was unique about our teen pregnancy prevention program is we created a component called Fathers First, because we found out in the lives of many of these young ladies there was drama and violence because the young men impregnated them and then disappeared. And we thought maybe one of the ways of reducing teen pregnancy was making these men be more responsible, because if they had to be responsible, then maybe they would think twice about having unprotected sex. Highly successful program. We had an alternative school called Detroit Cares. My first year we had 47 teen pregnancies. The second year we had 4. That's how successful we were at Detroit Cares Alternative Academy. We also, by the way, had a school-based clinic in that facility because I knew how important it was for our adolescents in particular to have health care. We also are the entity that wrote the first planning grant to establish the first 2 school-based health centers in the Detroit public schools, Northern and Northwestern high schools, and subsequently got a Robert Wood Johnson Foundation grant to operate those schools for quite a few years. We've been involved in a lot of robust prevention programs. We're impaneled by Detroit Wayne Integrative Health Network. You hear from David, who does our QPR suicide prevention program. We have a senior program that addresses gambling and other things with seniors who have a lot of idle time, about 50 seniors every single day, called our Well of Wellness. And then we also have our Recovery High School. We were the first entity in the state of Michigan to be funded to actually be able to establish a program for kids who had self-identified as having an addiction or thought they had a predisposition for addiction or were having trouble using. And that is a program that keeps those kids in an isolated environment, integrates within the curriculum, prevention, treatment, training, and other things that certainly help them keep themselves on track. And then most recently, and I consider violence as a threat to health, we received the $1.2 million grant from the Justice Department for our STOP grant program, which is a violence reduction and health promotion program. We've got some significant rappers and folks that are well known all over this country who assist us in those local schools where we're teaching kids how to respond to violence in peaceful ways. So now let's go into our clinic, into our building, and hear more from some of our staff.
Hi, my name is David Felton. I'm Vice President at Detroit Association of Black Organizations, also Director of Project Rainbow. Under Project Rainbow, we offer suicide prevention services as well as mental health first aid. We've been fortunate enough to work with the likes of actress Erica Alexander with our Question, Persuade, Refer program, which specifically targets those that are concerned about suicide and suicide prevention. As it relates to this training, it got the attention of the federal government. We were afforded the opportunity to train over 2,500 individuals that are associated with HHS. And also our Reverend Sheffield, who's the CEO here and the visionary of this great work, was featured in HSS Suicide 988 hotline video. We look forward to working with the community. We look forward to continue to have a positive impact on the community and some of these services that we're providing, and we appreciate the opportunity to work here in Detroit.
Hi, my name is Bill Coleman. I'm the Chief Financial Officer of DABO. I'm also the Health Navigator Supervisor for the Choose Healthy Life program. The Choose Healthy Life program is a collaboration of 10 Detroit area churches that provides health screening, blood testing, and COVID-19 vaccination throughout the community. It's been real exciting. There's 10, each church has its own community health worker, and those health workers coordinate various activities for their churches throughout the year. One of the more exciting aspects of this whole program is the Blueprint for Wellness, which is an initiative between Choose Healthy Life and Quest Diagnostics, the largest medical testing firm in the country. We provide free medical screening to members of the public, members of our community who come in, and it gives them all the details they need to know about the status of their health. And they can then take that to their personal physician, and if they don't have one, the community health worker's responsibility is to help them locate a primary health care physician. One of the ways we promote our activities is through every 2 months we have a morning broadcast on the radio with Mason, one of our more successful and popular radio personalities in Detroit. On that show, we interview people from the community. We talk about upcoming events, health events, and it's a way to make sure the entire community understands what we're doing here at DABO. Another responsibility I have is working closely with the project manager for the COVID-19 Health Disparity Council. The Health Disparity Council is an initiative of the state of Michigan where each community, each county is supposed to put together a council and start to collect data and identify what the health disparities are that affect the underserved communities in Detroit. So it's a very exciting activity, and one part and parcel of that is we get to give out mini grants to other local community-based organizations so that they can provide more input to our council for its monthly meetings. At the end of the process, we'll be able to make various recommendations to the state of Michigan about where the health disparities exist and how, and various opportunities and ways we might be able to address them.
Hi, I'm Aisha Price, board certified nurse practitioner at Premier Quality Health Center in Detroit, Michigan, located inside of the DABO Center, right at the corner of Wyoming and Grand River. And we provide services for citizens of Detroit. We work in the HIV project, Blueprint for Wellness, which is a comprehensive set of labs that we provide for all of our citizens for free. There's no charge here. In this community, we have high rates of hypertension, high rates of new cases of HIV amongst women ages 15 through 30. Those numbers are very alarming. And so with that in mind, we decided to open a clinic here in the DABO Center that provides services for uninsured or underinsured persons. Second program is Blueprint for Wellness. This is identifying risk factors for heart disease. Some risk factors include hypertension, diabetes, and high cholesterol. So Blueprint for Wellness allows us to measure those numbers for members of the community. This program is, again, free through the government. DABO has really worked hard to incorporate the services that are required to keep our community healthy. More than 60% of Detroiters suffer with or are living with hypertension. So DABO's collaboration and partnership with the former CDC Director, Tom Frieden, provided funding for us to start a program partnering also with Resolve to Save Lives to help lower those numbers. Our program was so successful, we've already presented at the American Heart Association and just did a presentation for the CDC. And last but certainly not least is trust the facts and get the vaccine. We lost hundreds of thousands of people to this COVID virus. Very alarming again. DABO was the first center to provide testing and vaccines in a local community. Having said all of that, we're very committed to getting our community well and doing whatever it takes to make that happen in the DABO Center. This is our nurse, Darnitha Harbin.
Yes, hi, I'm Darnitha Harbin, and it's a pleasure to work here at DABO, assisting with all these good, great quality programs here. And they just come in. There's a lot going on here.
Right, and we love to continue this work. So thank you for considering us.
Wow, man, we're doing a whole lot here, and we're so blessed to have great people to make it happen. Bill Coleman, the former superintendent of Detroit Public Schools, and David Felton, a Wayne County sheriff who works in our STOP grant program. And we've been able to train police officers in QPR and suicide prevention. Well, look, we've got a hypertension program you've heard about. We've been a part of the American Heart Association. We've reduced blood pressure within 10 days and kept it there for a year in 80% of our participants. You've heard about Trust the Facts, which is our vaccination program, having vaccinated over 5,000 people. We also heard about our community health workers, which Dr. Tori Harris runs. We have 14 full-time community health workers, 10 in churches, and then what we have not heard about, which I'll close on, is St. Augustine's University out of Raleigh, a historic HBCU, first one to have its own hospital, its own TV shows, now in our new center, training community health workers and offering bachelors of public health and masters of public health, with those students being embedded in our health programs, doing research, capturing data, and making certain that we have a really robust illness prevention and health prevention program. The life we save may be others and our own. Thank you for this opportunity.